Right, good morning everybody. Welcome to the Children's Scrutiny panel for Kirklees Council on the 11 o'clock on Friday the 11th of November 2019. We're just going to go a brief round of introductions. So I'm Andrew Marchington, I'm chair of the panel.
Helen Kilroy, Governance Officer.
Councillor member of the panel.
Joanne Sanders, Service Director for Learning and Early Support.
Michelle Wheatcroft, Head of Early Support.
Steve Combe, Head of Corporate Parenting.
Tom Brailsford, Service Director for Resources Improvement and Partnerships.
Councillor Viv Kendrick, Cabinet Member for Children and Young People Services Observing.
Thank you. We've received apologies from panel member Linda Summers and from Elaine McShane. So I think Steve's going to be picking up Elaine's items, and with support from colleagues. Yeah, if we could just press our red, when we speak, if we press the red button on that for the benefit of people listening online. Right, item 2. Are any members of the panel got an interest to declare? That's not okay. So this is a meeting in public, and there's no items on the agenda, which mean we should be excluding the public. Because we are now in a general election period, there'll be no public questions. So is item 4 gone? No petitions either. I don't think we've got any petitions anyway, so no public questions during this time. Okay. Right. So we're going on to item 5, the regular item on the panel, number and age of children in care. Number 5. Thank you. Steve.
Yeah, this report is to provide information to Children's Scrutiny relating to the number and profile of children in our care, including information relating to the number placed outside of the district. At the end of September, the number of children in care was 641. This was a slight rise from the month of August and followed a trend of steady rise since June this year. Even with that rise, when we look at how we compare with national average, we're just around national average and significantly below statistical neighbours with 64.2 per 10,000 population of our children in care. On page 5, you can see we've got the age and the gender breakdown of our children in care, and also details of the statistical neighbours we compare them with. On page 6, there's a breakdown of the ethnicity, both of the cohort and then ethnicity of children who've become looked after within the month. We have on page 7 details of children and young people placed more than 20 miles outside of Kirklees. This was a specific request of Children's Scrutiny to monitor this and report on a regular basis. You can see there that there has been a further decline in the number of children placed more than 20 miles outside of Kirklees. The number at the end of September was 78 children, which was 12.2% of the overall cohort. On page 8, there was a specific request from Children's Scrutiny regarding young people that we have in our care who were placed in semi-independent accommodation. Members had pointed out previously that there'd been news coverage around what is called unregulated accommodation. This refers to young people aged 16 plus, between the age of 16 and 18, who were placed in semi-independent accommodation. The reason it's unregulated is because there is no regulations for that type of transition accommodation. The key factor is making sure that it is semi-independent and that young people are exercising their own decisions in that accommodation. Specific request from Scrutiny previously was regarding young people who were in semi-independent accommodation, aged 16 plus, placed outside the Kirklees district, and the legal order that those children and young people are on. You can see there those 13 children, and the details and their ages are provided within that box on page 8. If there's any questions from...
Thank you, Steve, for that update. Panel members. Amanda.
Thank you. Thank you for the report. I just wanted to ask a question about the semi-independent living accommodation and the number of children that are placed outside of Kirklees. What happens in those circumstances? So they're placed outside. Do they come back into Kirklees? Are they placed elsewhere? Do they stay where they are after a period of time? I just wanted a bit of context, please.
Some of those young people will be temporarily outside the district and will come back into the district, into other placements. Some of those young people will be placed outside the district specifically because they may have family members living in another locality, so there may be specific reason that we place there. There'll also be some of those young people in semi-independent accommodation who for a number of years their foster placement or the residential care, the children's residential home they've previously lived in may have been in one of those locations that are listed. So some of those 13 would have previously lived in that locality. Then as they've got older, they may be going to a local college, etc. They've got their support network in that locality. So the answer to that question is there may be some who choose to return, there may be some who stay living in that locality. All of these young people are children, they have the status of a child in care, so they have reviews, they have social workers and leave-in care team involvement as well. So because they're outside a district does not mean that Kirklees Council isn't not exercising our role as a corporate parent. We still exercise our role as a corporate parent for these young people even though they're residing outside of district.
Any other questions? Yes, Dale.
Could you tell me how stable are the numbers of children less than 1 year being taken into care?
So that question relates to recent admissions into care in recent months and how many of those children may have been in that younger age group. Yeah. In terms of that, if we look at the children who've came into care in the 3-month period between July, August, September, there was 23 children who were aged 0 to 1 and 11 children aged 1 to 2 years of age. In terms of the outcomes for those children, some of those admissions will be temporary while support and assessment is done, and wherever possible we try to return children to the birth family if it's safe to do so. Some of those children, I'm aware that we would look to place with extended members of the family. So in terms of stability, that would be one form of stability, but then some of those children will remain in care and the plan may be for adoption, depending on what their circumstances are.
Just in terms of the trend of that, in terms of the stability, is there an increasing number of children who are being looked after, or is that stable at the moment?
I think in terms of stability, there was these 23 children in that 3-month period. In terms of ongoing stability, some of these younger children come to our knowledge, as I've said, return to family or return to extended family. There was in that 3-month period an increase in younger children during that period, but some of those will have been placed with extended family members. Some of those subsequently may have returned home.
we're going to keep an eye on whether that's a blip or whether that's a longer term, hopefully not a longer term trend. Yeah, thank you. Other questions? Other questions from panel members about numbers of looked after children? No, thank you. I've just got one more. Said there'd been this, obviously, over recent months, a slight increase in the number of looked after children. We're down from the historic high in Kirklees, and we're about lower than our statistical neighbours. Are we picking up any trends about whether this upward pressure, longer term upward pressure on the number of looked after children, or is that about stable, or is there still downward pressure on the number of children in care?
Yeah, if we went back to 2017, there was 705 children in care in Kirklees district. Then we come down to that number of 616. What we've seen is some increase in recent months. In recent weeks, the number has stayed around that 640. We are doing an analysis of the reason these children have came into care, where their children known to us are early help support services involved with these families. So there has been an increase, but we'll always, if children need to come into care, to keep children safe, we will bring children into care. If we believe to keep that child safe, they need to come into care, then that's what we'll do.
Right, thank you. Right, well, if there are no further questions on item 5, thank you, Steve, for that update on number of looked after. We're going to move on to item 6, which is update on repeat referrals and second time on care protection plan, which was picked up at the last meeting of the panel. Is that you again, Steve? Yeah, thank you.
Yeah. So, at a previous meeting, Scrutiny highlighted a concern regarding the number of repeat referrals, and specifically that if a repeat referral was coming in, did we miss an opportunity on the first occasion? Did we put the right support in place, etc.? So this report looks at re-referrals. If you look at page 12 of the pack, you can see the percentage of re-referrals and the August 19 figure of 28.6, which, if you look back over the year, was an historical high, as came down to 24.2 in September. We did mention a piece of work, there's a piece of analysis going on, looking at the details of these referrals. You can see on page 12 there is categories relating to the presenting issue. Reviewing cases is, as we state on page 13, is one of the quality assurance methods we undertake to ensure they've been closed appropriately and at the correct time. And the whole arena of embedding and strengthening our early help offer to offer further support families without the need for social care involvement is part of our improvement plan for the service. It's a key focus of prevention and greater collaboration with early support and communities. So this is an area we are looking at, and there has been some improvement in that month, and the work continues with the analysis and details within the report of that piece of work. So the previous scrutiny, it was said that was something that would come back. So whether you're going to look at this again, I mean, there is some positive trend in terms of decline in re-referrals between September and August, but we still are, our re-referral rate is above the statistical neighbour average and is above the England average for 2018.
Questions for Steve about that? Paul?
Well, question, comment, I guess. First, thanks. This is really good. It gives us some understanding of the underlying issues, and what really just stands out is the issue of domestic abuse, domestic violence, and that's clearly the key initiator of this issue of re-referrals. So I'd be really interested to hear what initiatives we've got are in place or thinking of putting in place to help us address that. I know there's some reference in the report to that, but just like to have some more detail about that. And is that something as a scrutiny board that we could be looking at going forward as well?
This is also an area that's of interest to the improvement board, and I think the whole thing around domestic abuse and violence is it's a key strand of work of the safeguarding partnership across the piece, across all children's services and across adult services. So I know previously at Scrutiny that colleagues from the safeguarding board have presented here, but that partnership working across the district to monitor and harness collectively services across the district, including statutory services such as the police, and work together to make sure we can create some positive improvement regarding domestic violence and abuse. My understanding is there's a range of activity going on, but the fact it's been highlighted will mean further focus in a number of arenas.
Yeah, sorry. Amanda. Yeah.
Thank you. Looking at the reports and the figures, particularly around domestic violence, there seems to be a trend around re-referrals during the summer months. And I'm just wondering if you've got any detail behind that. And it would also be interesting to know who are the complainants, who are the ones actually making the referrals. I don't know if you've got that information to hand, but, is it the child themselves, parents, social workers, neighbours, that sort of thing, particularly around the abuse?
I don't have that information to hand, but I am aware there's a piece of academic research being commissioned, and no doubt further forensic detail regarding the background of this data could be brought to a future panel.
Biotechnology. So looking at the figures, I'm just querying whether there's a correlation between the fact that the statistical neighbours, Kirklees, has a slightly higher rate of re-referrals, but then have they not? I could be remembering this wrong. Have we not got a slightly lower rate of taking children into care in the first place? So is there a correlation between those two different stats? So are we reluctant to take people into care at one point, or is it because, like you mentioned previously, about more complex cases? I don't know. Is there a link, or am I just looking at something that doesn't exist? I suppose is the question.
I think, as said previously on the other agenda item, we are clear that if assessments are completed and children in Kirklees children need to come into care, we will bring them into care. I think the comments that were made regarding the more forensic detail around this report, as I've said, I think that is something that could be brought to a future panel. I think it is a complex set, and whilst the headline statistics within this report, the more forensic background detail could be brought to a future panel. But I think in terms of when we look at those statistics and the figures we're looking at the Kirklees 2019 statistics. We're looking at the comparator average of 2018 for England. Now, we're aware that across the country there's been rises in a number of, for example, children coming into care. There's been rises in a number of areas in terms of some of the challenging circumstances across the country. So I think when we look at that statistical neighbour comparison in this instance, there is that caveat around remembering that we talk in the here and now 2019, and the statistical neighbour measure dates back to 2018.
Thank you. Sorry, Paul.
just really a comment here, I think, for ourselves as a panel, just going back to this issue of domestic abuse and domestic violence. It's such a critical factor, not just in this, but obviously in other factors affecting our children. Is it something that we should look at in terms of having a view as a scrutiny panel on what initiatives we're doing as a local authority, what are we driving forward? It's just a thought for us to talk, I think, separately perhaps to this. Yeah. But it is certainly a very important factor in what we look at.
Yeah, and just to respond to that, I mean, historically, repeat incidents of domestic violence were an issue for the Community Safety Partnership. And also one of the things in the past historically that we've looked at are the impact of domestic violence on children and young people, because sometimes that's not been thought about. And obviously if a child's in a house where abuse is taking place, that has an impact on them as well. So I think there's some interest. What I would, just in response to Steve's point about the research that David Thorpe's doing, Professor Thorpe's doing, it would be useful actually to have a look at that at the moment, see where, because of the questions I got about that in particular, the scope of, what is Professor Thorpe looking at in terms of some of the wider impacts. Is he looking at a whole, holistic approach? Because if there's issues around, if there's other factors happening in the household which might be risk factors for domestic abuse, is that been looked? Because some of this might be out with our control, and it does pick up with Richard's point about obviously the two things are linked, but that doesn't mean there's a causal link. And the summer holiday, thinking about some of the work that the local authority has done in the summers about poverty, making sure that children have access to meals and activities, each actually looking forward. Are there tensions within families because people are spending a lot more time together in terms of early intervention and prevention? If Professor Thorpe picks up on that, other things we could be looking at to say, well, to reduce this as a whole. So, sorry, Tom. Yeah.
Thank you. Just a couple of things. I think in terms of the domestic abuse agenda, we are aware there's domestic abuse strategies now being produced. So I wonder whether we need to think about scrutiny being cited on how that crossover works between children and the adults agenda, which I think is really important. I think, in terms of some of the re-referral data, I think what's not maybe helpful in the way that we've presented the re-referral data is that the national and regional comparator figure is static. So we haven't got a month-by-month account of how that's changed nationally and regionally. So actually it doesn't, although we can see an increasing trend in re-referrals, we can't really compare that with real-time data, which I think is a bit of an issue. And certainly in terms of the work that Professor David Thorpe will be doing, that looks at the risks across the board, so it will pull in the whole risk agenda, so that should give us some input.
Like Councillor Pinnock, I was also interested in this relationship between school and college holidays. And what occurred to me to ask was, does the council have any relationship with third sector organisations to which young people could be introduced so that the time when they are at home, they might not be at home for as long? Does the council have such a relationship with the third sector?
Yeah, there's a couple of things going on at the moment. Obviously, over the summer we had a detached youth work programme where third sector colleagues volunteered, if you like, to come together under the council's umbrella to put a detached youth work programme in place, which has been really successful. And also the Kirklees Youth Alliance, we commissioned them to do a bit of work called Healthy Holidays, which was about engaging with families in the school holidays, making sure that there were activities on, and also making sure that children and young people had, the right nutrition and food, which has been quite successful. And I believe there's an evaluation report that will be coming to Cabinet, I think, in December around that. So the third sector have been quite heavily involved in terms of dealing with families' issues outside the school hours, really.
Thank you. Should we move on then to the child protection plans for the second part of the report? Page 15. Questions or comments on that?
Yeah, so I think this came from last Scrutiny's request to look at the repeat child protection plans. I think when we look at it, the reasons why there are repeat child protection plans are fairly varied and wide-ranging. Some of them are about increased concerns around adult mental health problems, domestic abuse or contextual safeguarding factors. Data currently identifies there are 70 children locally who've been made subject to a repeat child protection plan within 2 years of the first child protection plan ending. Of the 70 repeat child protection plans, a number ended after a relatively short period of time, either due to children and young people becoming looked after or professional decision making assessing that the identified concerns have obviously reduced sufficiently for them not to be on a plan. In terms of the categories that children and young people have been on a plan for, neglect's obviously the overriding initial reason in terms of significant harm. And in the last 12 months, no children had a repeat initial significant risk of harm category or physical abuse. Less children were made subject to a plan under the category of emotional abuse, which is positive. When we compare the re-registrations for child protection plans to the ones where children have previously been subject to a plan, the number of plans has been historically below our statistical neighbours and the national figures. However, it's recognised that this has increased in the past 6 months. So part of what we're going to be doing is through the equality assurance activity. So we're developing a quality assurance framework across children's services. We're going to monitor the plans and make sure the plans have got the right outcomes and monitor the reasons that children are coming on plans and being discharged from plans. And when that quality assurance framework is complete, we do plan to bring that to scrutiny as well for further discussion.
Questions on that part of the report? Dale.
I'm looking at the third comment from the end. For the half of the children made subject to a repeat plan, the second plan commenced over a year after the previous plan ended. So what I was wondering was whether the intervention that ended in the cancellation of the plan, was that actually robust enough for it not to have been able to continue in the long term?
Yeah, I think that's an interesting question, and I think part of the quality assurance framework being in place will help us dig down to answer some of those questions in terms of measuring the outcomes and the robustness of the intervention, and why, did the child protection plan end because of those interventions, or were there other factors, and then examining why the child protection plan started again, in a 12-month period. So I think part of the quality assurance framework will help us dig down into that.
Yeah, I think that's the interesting thing I've highlighted. It seems that it's appropriate for the child protection plan to stop its own what the ongoing support is, and presumably it's a risk. If you've been on a child protection plan, it's a risk factor. It's having appropriate support in place that falls short of that. So it'd be interesting to see if we could have some information coming back about that, Tom. That would be really good. Okay. Any other questions or comments? Yeah, Paul.
Just a quick one. Again, page 2, saying last sentence, however, is recognised that our figures have been increasingly in line with comparators over the past 6 months. Have we got any view at this point why we've moved up, or is that part of the quality assurance?
It will be part of the quality assurance. I think we've had systems in place internally which may well not have helped that in terms of the process of cases being escalated into the Child Protection Review Unit. But I'm this week I'm just looking into that, but the quality assurance framework will pick the majority of that up.
And again, I mean, given that the primary reason for a second child protection ban is neglect, it'd be interesting to know what the underlying factors are about within those particular situations and whether there's a wider issue going on. Okay, thank you, Tom.
And I think the other thing, obviously, that will help is when, children are coming off plans and we're looking at the early help offer and trying to understand that neglect element. So I think it all feeds in to the systemic approach around it. So, yeah.
Right, no further questions or comments. If we move on to item 7, early support partnership.
Okay, good morning. This report is to update Scrutiny on the developments of the Early Support Partnership, and that includes the Council's service delivery of early support. So just a little bit of background really. The new Early Support Service was established in April 2018, and since then the service has developed quite considerably. So the Early Support Service is non-statutory services to children and young people and their families, and the local authority service now includes family support, parenting and group work, family group conferencing, multi-systemic therapy, a family mental health service, stronger families, early years, children's centres and the community hubs offer, and soon to have a youth offer, hopefully in the new year. So you can see that has expanded quite a bit. We identified that it was important to undertake a review of the wider early support partnership, and we commissioned an organisation called People2, who evaluated the early support partnership, which included the local authority and the external delivery. We received a report in May which had a number of recommendations, and that was taken to Children's senior leadership team, who agreed for some of those recommendations to be implemented. So some of those recommendations were to develop a vehicle to drive the Early Support Partnership forward. And since then, we've now established a task and finish group, which has been chaired by the Kirklees Children's Safeguarding Partnership. So that is very much in its infancy. The second one was to develop a clear multi-agency pathway and a panel process. That is a little bit further forward. So we have a launch of the panels next week, and with about 300 attendees booked onto those sessions on Tuesday, and the panels will launch very soon after that. We're looking at 2 higher level administration areas for early support, so looking at North and South, which will align with children's social care, and we're adopting 4 localities around our 4 designated children's centres. That's where the early support staff are currently based. And the last recommendation was to increase the management capacity within the early support service, which is well underway. So we're putting in 3 service managers who will have specific focus, one on youth service delivery, one on family support, and one on the children's centre community hubs offer. And then under there will sit 4 early support team managers who will do the operational across those four areas. And the interviews for the service managers will take place at the end of this month. So we hope to have that new structure in place by definitely early in the new year. So just to give you a little bit of an update on some of the teams within the early support service, family support remains a stable team, and any staff movement has been for promotion within the family support team and opportunities, and a couple of staff have been successful applicants for this Kirklees Step Up to social work, so they are actually stopping within Kirklees. We've also had a recent recruitment, and which was very positive, and we had a large number of applications which we received, and I think that sort of gives the message that the service now is somewhere where people want to come and work. So that's really, really positive. At the end of March, we had 2 commission services which were part of the early support offer, which was managed by Action for Children and Humankind. We actually successfully brought those into the wider early support service under the implications of 2P, and that has gone really well, and now they're integrated into the wider family support team. So just in terms of the family support service, we're currently working with around 985 children, so those are active cases, and those are cases at early support status and cases that are actually where we are supporting children's social care. The higher number of referrals are coming from the Dewsbury and Murfield areas, and the lowest number of referrals we're receiving are in the Combe Valley and Golka areas. So on average we're receiving about 90 referrals per month into family support, with the highest numbers coming from schools and very closely followed by children's social care. So we're continuing to develop the family support service and embedding a local offer across those four areas, which the teams are working in, and children, the teams are now linking into the community hubs. And again, we've had some really positive feedback, and the primary link into the community hubs are the casework consultants. So I'll now move on to the parenting team. So the parenting team, we have a dedicated parent team as part of the family support offer, and they offer a number of evidence-based programmes which range from early parenting to support the impacts of children subject to domestic abuse. And that was a question asked earlier to Steve. We've done some evaluation of the parenting service, and we've identified some improvements that they are currently working on. One of those was around recruitment and retention onto the programme. So we've put some new things in place, and one of those is that we've linked a dedicated parenting member of staff into the community hubs, which is working well to make sure that we're getting the right support in there for parents, and we're actually delivering the right service in the right place. Something else that the team have begun to do is offer home visits, so the parents knew what the expectations are of the programme, because the evidence-based programmes are a 12-week programme, so that it is quite a lot of commitment for parents, and that seems to be working quite well. So just some of the next steps to a parent team, they're just exploring running some sessions in the school holidays, so that can work as the families together in that learning environment. And we are just in discussions with Locala about co-delivering some parenting courses, particularly for the early parenting programme. So we're just looking into that, but we hope to have that up and running by January. Move on to the family group conferencing. Family group conferencing are voluntary decision-making meetings to help families find their own solutions to problems and stop children being taken into care, stopping in the family unit. It's a restorative approach, and that empowers families and their wider family network to draw on their strengths and resources to make it a safe plan for the children. Again, The family group conferencing team is now a stable network, and we have 2 team leaders and 10 coordinators who are now all in substantive posts, and this will allow us for further development of the service and embedding that entitlement at the earliest opportunity. Since the start of the extended programme in April 2018, the team has received a total of 365 referrals, of which 318 was received from children's social care and others from schools and family support workers. 114 of the referrals had outcomes met, where there was a successful FGC. And the higher number of referrals at 59% was from the North Kirklees area, with the majority of them living in the most deprived areas of Kirklees. So currently the main point of referral for the families for FGC are currently children in need, child protection, or where a public law order is initiated when children are most at risk of becoming looked after. And we've been working really closely with children's social care to embed FGCs as part of the process. So just in terms of the next steps for FGC, we want to develop a service so we can embed the entitlement at the earliest opportunity. And plus we're going to be looking at exploring some community conferencing as well. So that's FGC. Move on to multi-systemic therapy, more known to us as MST. So it's an intensive family and community-based intervention for children and young people, age 11 to 17, where young people are at risk of out-of-home placements, either care or custody due to their offending or having severe behaviour problems. And again, this is with new team. So since the team began seeing families in just February 2019, they've had some highly successful periods with excellent individual team and family outcomes. There've also been suitable referrals to service, which have been high and consistent through that period. And you can see from the report there, we've had some good outcomes that are hopefully turn into financial resource savings to the local authority and its partners. The next period for MST, we're looking to expand the offering in Kirklees and develop 2 new additional teams. One to focus on young people at risk of exploitation, and one to develop services for children with a plan to return home from looked after services. There was a successful bid put into the Youth Endowment Fund, which means that we've been able to put more investment to fund one of those services. I think the funding is still to be confirmed, but that bid was put in by MST UK, and we'll be developing those with 4 other local authorities, but there's around £2 million to share. So the Mental Health in Families team, they coordinate appropriate early support for parents with mental health difficulties and share the information relevant to the welfare of their children, with a focus on managing risk and increasing resilience, building strength and encouraging independence, reducing long-term needs for the service. Again, the service works restoratively and uses a whole family approach. So the team are continuing to work with professionals who are case holding from both adults and mental health and children's social care, and they regularly have case consultation in order for them to better understand and analyse that impact of parental mental health upon their children. So alongside case discussions for specific families, the team have been running some bite-sized sessions for children's social workers in order for them to better understand mental health services and the role of the workers in the service. So again, this team has developed over the past 12 months, and some of the next steps for the team is to develop support to the duty and advice team and work with colleagues along from the early support service. So the community hubs, we've got 17 community hubs across Kirklees, and that brings together early years, primary and secondary partnerships. The hubs are at varying stages of maturity, but they act as a vehicle for a broad range of services to come together at a local level. Hubs are also a way of working that is designed to contribute and to support the development of the place-based working arrangements. At the moment, we provide some support for the development of the hubs, and we've got a small project team, but more recently we have employed 9 community hub coordinators, and again we're getting some good feedback on the links that they are making. We're just doing some work on how we can look to sustain those roles. As mentioned earlier, we've got family support that have now linked into the community hubs, particularly the casework consultants have been that primary contact, and their role is to very much embed that whole family working through relationships with the partners, including schools, to provide that seamless early support service. So at the moment, the majority of the casework consultants are funded through our Stronger Families budget, which is the National Trouble Families Programme, and some from the wider early support budget. We had some news a couple of months ago that the government has decided to extend the Trouble Families Programme for another 12 months because it should have finished in March 2020. We've said that will hopefully continue as it is at the moment, but we're just waiting for further updates, but that will now follow on from the general election. And lastly, I know it's mentioned earlier from Tom, just in terms of a youth offer for Kirklees, we held a youth summit in May with around 150 attendees, with the keynote speakers being the Children Commissioner for England and the West Yorkshire Police and Crime Commissioner as keynote speakers. So that was a call for action to develop a new youth offer in Kirklees, and as Tom said earlier, we have had a detached youth offer running over the summer holidays. We've now extended that till the end of December, so that had 5 detached youth work teams working across Huddersfield, Batley and Dewsbury. The programme involved 13 Kirklees employees from across community services and early support, as well as 5 youth workers from the voluntary and community sector. So the majority of the sessions have been delivered late afternoon when young people are out, but some sessions have been delivered in the evening as well. There has been some good engagement across all areas. A total of 878 contacts were made with young people, where they've been able to discuss a whole range of issues with youth workers, including conversations on their community, health and wellbeing and local provision for young people. So we will use that information as part of developing the permanent youth offer for Kirklees. So just in terms of the next steps, we have a youth development programme board which has 5 streams, which has had its first meeting. The work streams are just about to take place over the next months in terms of developing that offer. And then recently, this week on Tuesday, we had a feedback of the youth summit, and we had around 100 attendees at that, where we gave an update of the detached youth work over the summer, some research that the Huddersfield University is doing, the Healthy Holidays programme that Tom mentioned. So that was another successful event where we heard some positive feedback. And then there's just some next steps there in the report for early support. That's quite lengthy.
Thank you, Michelle, for that. Questions or comments on the report? Richard, initially. Yeah.
I suppose my question is quite a lot of new things in here, isn't there? I suppose I'm trying to phrase it without sounding like I'm criticising. What I would like to ask is why has all this new stuff been done really succinctly, and I suppose what problems are you trying to fix, and then in the future how do we measure whether it's been successful or not? Does that make sense? I'm not criticising because there's loads of detail in here, and a lot of it sounds good, but if we are to scrutinise a decision-making process in the future, we'd like to be able to see what problems it was addressing in the first place, and then in the future, how much better is it, or has bits of it worked and has bits of it not worked, etc. Does that make sense?
It does, yeah. So there is quite a number of new things in there, and 3 of the projects are part of the improvement plan. So the Family Group Conferencing, the MST and the Family Mental Health team was all funded by the Department of Education as part of the improvement plan, and that funding was until the end of March this year, so that we've now been able to sustain that within the offer. We are still working up some data reporting, so we will hopefully be able to bring that quite soon, so there will be some data there to analysis, and we have got some more data that is available at the moment, so yeah, we'll take that on board.
Yeah, thanks, Richard. I'll come back. It's really, but in the light of some of the stuff we talked earlier on about repeat referrals, it'd be interesting to see how potentially some of the early intervention work could have an impact on reducing the risks of those tensions within families that might lead to repeat referrals to children in care or to the child protection plan. So if they can bear in mind that'd be really useful. Okay, sorry, Paul.
Yes, thanks for the report. I found it a really great read, and some of this was very new to me. I think probably to some of the other panel members as well, partly because we're new to the panel. But in terms of the range of interventions that are taking place, and I had a similar question to Richard, how are we going to measure the impact of this, the better outcomes? And hopefully it will reduce the number of children going into care in future years, and that'll be a big thing, won't it? I was just very interested in how you've been working with schools in terms of rolling this out and how successful that has been. Are schools really aware of this and helping you in terms of delivering these services?
They are, and the schools have been really on board with the early support offer. So our link through schools is through the community hubs. So we have, as I said, 17 community hubs, and for each of those, the schools are all, majority of schools, I'd say probably about 99% of the schools are all in a hub. So that is their links. So that's where we've done quite a lot of work, particularly over the past 6 months, in work linking in sort of the family support teams, the casework consultants. So they are getting that support. They're really on board with the multi-agency panels, which we are launching next week. So we've got a number of schools that are coming to those launches and as well. So we have had some good buy-in, and there was part of the early support launch that we had back in January as well. I don't know if Joe would like to add anything.
I think this is very much what we've given an update about is about council services, and part of this is about partnership and partnership work with schools, early years settings, post-16 colleges is absolutely crucial because they're a universal service. They see parents, they see children every day, and there's a huge commitment from our schools to contribute towards keeping their youngsters safe. It helps with that rounded child outcome. So there is a huge commitment. It's how we make sure it's consistent so that there's a shared understanding across the partnership. So it's about schools, health, social care, family support, so that we're getting the right service to the child at the right time. And like you say, absolutely trying to prevent, or where youngsters can be, I hate the phrase, but step down, where they're considered safe, that they've got continued support, and schools are really crucial in helping us develop that moving forwards.
again, I'll echo what everybody says. This is impressive. I look forward to more information going forward, so we can understand some of the correlations in the relationships with other aspects. A couple of things I'm interested in. You may not be able to give me more information now, but certainly on the youth offer and the children's centres offer, what is being looked at the moment? What's the thought process at the moment for that going forward?
Okay, so at the moment we have got the detached youth offer, which we've committed till the end of December, but the work around the longer term youth offer is going to come out of the programme boards. So we have 5 work streams. So we have we're looking at a prevention pathway, prevention pathway, we're looking at the offer for communities, there's the youth zone offer, the detached youth work offer. There's another one. That's fine. So all the work will come out of that programme board and those work streams for that, for the youth offer. And there is a commitment from the local authority to fund that. Just in terms of the Children's Centre core offer, we're going to have another summit in January. We're looking at a date for the end of January. So again, we want to work with partners to co-produce that Children's Centre offer, but not forgetting what we've already got that's happening in the community hub. So we need to map that out and look at what the needs is across Kirklees, working with our health partners, voluntary sector partners, and just re-look at that. To go.
And I think, sorry, just to add to that, that's where the hub working is absolutely crucial. It forms part of that entitlement to a core offer, but we need to develop that, not the council sit in a darkened room, but do that with partners. So the sessions in January are going to be crucial to make sure that it's the phrase that we've used more than once, so that it's unified but not uniform. It's got to meet the needs of local communities, and we've got lots of diversity across Kirklees, so it's crucial.
I'm glad you said that you're going to be talking to people on the ground and obviously through the hubs. And you probably know we've just restarted the Home Firth or Home Valley hub as such, and so that's sort of fairly new. And so I know we're very keen to engage on this issue certainly around youth offer and I think children's centres as well. And I understand the priorities and resources across Kirklees, but I'm putting the plea in again. We know there are issues in our rural and semi-rural areas, which are different issues, but nonetheless, we've got to find a way of addressing those as well. Good.
I agree that this report contains some extremely encouraging things. So what I'm asking is a clarification. I'm looking at family group conferences on page 22, and it says that in April 2018, 365 referrals, 318 from children's social care, 114 of the referrals, approximately 1/3, had a successful family group conference. What happened to the rest?
Yes, so some of those will have been inappropriate referrals or families didn't engage. Okay, but we can certainly get you some more information around that. I just don't have that to hand, but we can get that.
Just that it just seems strange that it was just left like that. 114, less than, approximately 1/3. And so we have no idea what happened in all the other family conferences. So I found that a bit concerning.
Yeah, some of those, as I said, may have been inappropriate referrals. So some of those family conferences may not have taken place. So although there was that amount of referrals, they may not have all gone into a family group conference.
Yeah, well, thank you, Michelle, for all that, lots of information. I think in terms of going forward, the next steps, clearly early intervention prevention is part of the 10-point plan. I think the number of panel members and yourself have touched on, we need to look at how it's the evidence. I mean, looking on page 8 of your report, page 26 of the pack, about the working with the performance information unit, develop the data evidence to look at the impact. I think from a scrutiny point of view, we've heard there's a number of conferences and things happening and launches. Actually, if I think it is useful if we could have an informal an invite to come as an observer to some of those. But also when you're thinking about the impacts on outcomes, that, you know, why we're having a conference, why we're having, and some of those things, be useful for us to know about that. If we know early enough, we can perhaps pop along to some of those and listen to how you're, you know, looking at what is effective and what's not effective in terms of that. So that'd be really useful.
No, that's absolutely fine. More than welcome. Thank you.
Paul?
Chair, just one question. It's the detached youth offer, and it's for my education. I don't know what that means, and I was wondering whether everybody else understood it.
Okay, so a detached youth offer means that we have youth workers that are going out on the streets, so actually going out and finding out where the youth are. So there's a number of hotspots across Kirklees where they have been sort of targeting since summer, so they're just going out there and talking to the young people on the streets.
Thank you, panel members, for comments and questions. Thank you, Michelle, for your report. Right, we're going on to item 8 now, which is the verbal update on Almonbury Community School.
Thank you, Chair. It'll be just a brief verbal update, although much has happened since the last meeting of Children's Scrutiny. I think we shared with you at the last panel that we've been able to offer clarity to the majority of groups of parents. So youngsters in the primary phase had some clarity about which school catchment area they had priority for. We were able to talk about admission numbers. What we hadn't yet been able to communicate to parents about was the youngsters who currently are on the roll at Almonbury Community School in the secondary phase. Since that time, and to be precise, on the 17th of October, we were in a position and did write out to all those affected families. We did 2 letters, one for children who were in year groups 7 through to 10, because they would still be requiring a transition of a school place at the end of the academic year 2020. But we also wanted to write to families of youngsters who were in current year 11, so that they weren't left without some communication and clarity. I think what we said last time and what we've been very keen to do is to work with our partnership of local schools to make sure that there was opportunities available for a good transition for the youngsters who are affected by the proposals. What we've been able to work together upon then was to give the parents the opportunity to make a preference. So we've been working creatively with Netherhall Learning Campus, King James's School and Newsham High School to enable parents to express a preference for either one of those schools. So that we also, to help them understand what that would mean in practice, we put on an event on the 24th of October. It was held at Almonbury Community School, and there was representatives from King James's School, Netherhall Learning Campus and Newsham, so that they were in a position to be able to explain to parents about their curriculum offer, answer questions about uniform or school timetables, the shape of the school day, anything like that. At the same event, we had Kirklees Council officers who were able to give advice and guidance to parents about, I suppose, more complex sibling groups. So you know, we were very well aware there might be youngsters who were currently on roll in the secondary part of the school, who had younger siblings in the primary part of the school, and were trying to make joined up decisions for their youngsters. So we were able to offer that advice and guidance, and I think the feedback that we've had has been welcomed by the parents of youngsters on roll. What we're currently in then, we're in a window where we've asked parents to return a form to us or drop us an email or return the form electronically, expressing a preference for where they would like to be, their youngsters to be. The deadline is today, and we are working really closely to, as I've said previously, to work with all families and to track all those youngsters to make sure we've had a return for each one. There is a high number at this moment in time where we've received a response from. There are still some outstanding ones, but we will make sure that we have spoken to each and every family so we understand where those youngsters would like to be from September. Once we have that information, it's then we can start doing the detailed planning around transition and make a formal offer of a school place. But that's why you've got a verbal update today. We'd like to be able to put more detail because we'll have been much further down the line in terms of understanding the numbers and the year group breakdowns of what will look like for families, and therefore how best we staff that and work with transitional arrangements to do the very best for those youngsters. I'm more than happy to answer any questions that Scrutiny might have.
Thank you, Joanne, for that update. Questions or comments? Richard?
One of my concerns before, when we've talked about this in council and in other panels, is there are some families that seem to have a real problem with distances and travel to other places. Some of that is regarding the actual child at the school, but some of it might be other siblings who are, I mean, I suppose with most kids at high school, they can get themselves there, generally, I suppose, I'm summarising. But these families that were concerned in the past seem to be suggesting that the only options available to them were sort of 2 or maybe even 3 bus rides away. Are we confident that that issue is not going to affect anyone, or do we have an idea of how many people will still be in that position?
So in the letter, we absolutely acknowledge that had been a concern from parents because I suppose as well at that time they didn't know what was being offered to them. I think one of the greatest fears from parents was that we were just going to tell them where they must go. Because we've been working with the partnership of schools, we do think that being able to offer youngsters to make a preference for one of those schools, that will resolve a lot of transport issues. For example, King James is within the village of Almondbury, it's within a reasonable distance. Netherhall and Newsham are, and it does depend upon whereabouts you live as to whether, but we do believe it's a reasonable distance. What we did put in the letter was that we would look at individual arrangements if there were still concerns about transport. We've tried to be clear what we won't be doing, and what we won't be doing is putting on bus routes that wouldn't be sustainable, because that's not something we can do. Wherever possible, we'll apply the home to school transport policy, but if there's a particular set of circumstances, then we will be discussing that individually with families. But I hope that the reasonable offer should take away most of those anxieties in that respect.
Can I just about the transport, I'm not sure what you called it. It's basically the reasonable transport. Is that what you called it? I'm thinking back to a conversation with people in my ward, and this is equally applicable to people who might go to other schools around Elmenbury. If the first choice of the school is within a certain distance, or the parent doesn't want the child to go to the first choice of the school, I think, I'm badly explaining, but I think you're going to get what I'm talking about. If there is a situation where the young person or the parents think that the most appropriate place is slightly further and it's slightly outside that 3 mile area, we need to accept that some of this has got to be treated with a lot more sort of flexibility than under normal circumstances. I think in this case, I think you sort of alluded to the fact that that's what's going to happen, but you didn't quite say it.
Well, what we I don't disagree with what you're saying. I think what I've said is we think we've not said displaced pupils, you must go to this school regardless X, Y, or Z, regardless of where you live. It is an unusual set of circumstances, and the families that currently attend Almonbury Community School may not necessarily live in the catchment area. There might be some from a slightly wider area. In the first instance, we think we've given people the opportunity for a preference which is within a reasonable distance. And in those circumstances, our first point of call will be to apply the home to school transport policy. If that poses a particular difficulty, we will look at individual circumstances, because you are right, this is an unusual set of circumstances. So we're trying to do it on an individual basis rather than a blanket. But I think we needed to be really clear that what we weren't going to be doing is running a fleet of buses, transporting youngsters, because that just wouldn't be something we're able to do.
Thank you, John, for that update. Just to also update panel, we did receive an invitation to go to the 24th of October event. I went along to that as an observer. That was really useful for us to corroborate some of the information that we've been presented at panel. So a lot of the concerns that parents had actually had been addressed by the letter that had gone out. That had clarified a lot of cares and concerns. It was interesting to talk to some parents, to our staff, and also to the teaching staff there as well. It was a really useful exercise. So again, if we can, if there are other opportunities that you think for scrutiny members to go along to observe the process, to help us in our role, that would be really appreciated. But thank you. So just the feedback with panel on that. Okay. And I'll follow up some of the points that has been raised about transport with and other individual issues at the briefings that we have, regular briefings. So thank you. Right. Oh, that's me again. On to item 9, the work programme, the panel, the back of that. Yeah. So again, at the last meeting of panel, we talked about how we can more effectively scrutinise the work within this area. The 3 strands of that were about scrutinising effective partnership working. So in the light of the agenda we've had today, we're thinking particularly what Michelle has said and some of the points that Steve and Tom have brought back about the impact of other partners on the work of children of the services. We've received an invitation to a multi-agency meeting. I think Elaine McShane made that offer, and they're on Monday afternoons. I will be going to one of those meetings, and there's an invitation for other panel members to come along to those. We're going to have so that not all of us turn up, so we can observe rather than impact on the meeting. We're going to do a programme of that as well. The other invitation we've had is to single point of access Northup, or we've had an invitation from Lacala. So again, if we email around and find appropriate dates and times for panels to do that, so we can corroborate the invitation. I think Steve was saying there's also an invitation from Laura about.
Yeah, that was an invitation to the placements team based at Civic 1, who are responsible for both internal and commission placements for children in care.
Yeah. So what we're going to try and do, and I think that is to go to do visits, and then, to actually prior to reports coming to the meetings, so then we can corroborate some of the information that's coming back through. Okay. I think we will take on board, Paul, you'd raised the point about issues around domestic abuse. I think if I bring that up in, I've got with the briefings, informal briefings that are coming up with both cabinet members and lead officers, and see how we can integrate that into the work programme. That would be really good. Are there any other comments about stuff that's coming through on the work programme at the moment? No, that's fine. Thank you. Okay, so the date of the next meeting is the 16th of December. The public meeting is at 11 o'clock. Major item on the agenda is about the review of the improvement journey. So if there are opportunities for panel members to do some visits, some observations before that meeting to give us a bit of a flavour on that, we'll try and arrange those as in the next 2 or 3 weeks if we can do. So thank you everybody for their contribution and their attendance. Next meeting, 16th of December. Right, we're now not live. Thank you. It's fine.
It's not keeping up. It's still showing you speaking. Right, it's still